We're doing a range of suicide prevention related projects here at Orygen that range from right up at the policy end, so working with state and federal government around the development and evaluation of suicide prevention policy, specifically in relation to making sure it is evidence-based and talks to the needs of young Australians, right through to the pointier end where we're actually working with young people who are at risk of suicide, mainly in school settings. Unfortunately, suicide rates amongst young Australians have been increasing steadily over the last 10 years, and that pattern's particularly evident amongst young females. And we also know that self-harm and other forms of suicide-related behaviour are also increasing. So it's really important that what we're doing is building an evidence base upon which can be used to inform preventative approaches, both at a clinical level, in school settings, and also at a policy level. The research that we've been doing is quite varied. So we've been testing, I suppose, a range of approaches, including educational approaches with young people and with, for example, school wellbeing staff who come into contact with vulnerable young people. And we've been testing individual interventions. So, for example, online interventions with young people who present with suicide-related thoughts or feelings. And what we're beginning to develop is an evidence base that tells us that those sorts of approaches are acceptable with young people and they're safe and effective. We know that educational programs are now safe to implement in a classroom setting, which is a new piece of evidence that's not really been tested before in this country. And that those sorts of programs do lead to increased likelihood of help seeking and, again, an increased sense of capacity when it comes to helping a friend or helping yourself when you're having difficult feelings. We know that young people, particularly young people at risk of suicide, don't like seeking help, and they don't like seeking help necessarily from professionals. But one of the things that we do know is that online interventions, including those delivered through static web-based platforms, but also through social media platforms, do increase the accessibility of professional support to young people, including young people in rural and remote locations who might not have the broad range of services that are available in metro areas. We involve young people in the work that we're doing in a whole number of ways. Probably a really good example is one of the social media projects that we're running at the moment in high schools across Melbourne. And there we're working in direct partnership with young people to develop a suite of interventions or messages that can be delivered through social media, through a whole range of social media platforms, with the idea being that these are messages or interventions that have been developed by young people for other young people. So we know that the anonymity that online platforms affords is liked by young people. They find them less stigmatizing to use. They can use them from the privacy of their own homes 24 hours a day.